So in clinic, we have introduced a biostimulator treatment in clinic. I watched and waited to make sure that this was actually going to work, and I've interviewed quite a few people who've had it done or who've been using the product, and one of our doctors has been using it in the UK for about 3 years with great success. And I have started using this about 4 weeks ago, and it requires 2 treatments. So I'm already into the second treatment with some people, and it seems to be working really well as a biostimulator and a hydrator of the skin. And it almost looks as if it's tightening the skin and lifting the skin, particularly around the mouth and around the face here. But there's no tightening involved. It seems to thicken the skin, but it seems to work really well. And it's the first new product that we've had available to us for quite a while. So this particular biostimulator that we've started using is injected in 5 different lots on the face, on each side of the face. So basically here, 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 and here, but on both sides of the face. And then there's a second injection process about 3 to 4 weeks later, and then 6 months later. And what it does is it treats the aging concerns people have. So if people have a lot of lines, wrinkles, or sort of a lot of sagging in the face here, it basically thickens the skin all over the lower face. It doesn't treat the upper face at all. It's just the lower face. And it stimulates collagen, supports the keratinocytes, which are the skin cells, supports the fat cells, and reverses that process that's gone on. So it's an anti-aging, but a very natural look. It's not a filler per se. It works very well with our muscle relaxant treatments, but also our filler treatments. They're a different thing altogether, but this is something that is injected in a small amount. It's quite painless, really. That's perhaps a little bit of pain with needle, but it's a very tiny needle, and we use ice when we do it, and it really then spreads under the skin within 15 minutes. There's a spreading effect, so it's very unlikely to cause any side effects or bruising or anything like that. And basically, people usually by the next day look pretty normal and can go about their normal activities. And then the product, the biostimulator, tends to work gradually over the next 3 weeks, and about 3 weeks after you've had it, you start seeing a difference. And then around that time or a bit after, you have your second lot of it, and about 3 weeks again afterwards, you start seeing a difference. But it keeps improving. The biostimulator keeps improving the skin for up to 3 months afterwards. And then at about 6 months, it maintains. At about 6 months, you have another treatment normally. So it's very good for the concertina lines. Some people have, or the textural change some people have on their cheeks as they get older. Not everybody gets that, but it's very good for that. And the really good thing is it's really natural. It doesn't give you big lips or big cheeks or anything like that. But it will spread and hopefully improve even lines around the mouth, the chin, and the texture of the skin. So it thickens the skin and does improve a little bit the under eye area as well. Every 6 to 12 months. So 6 months at the top up, and then it's 6 to 12 months after that. And it depends how many lines you have, how your quality. So some people have lovely, aren't too bad, and other people have quite a lot of an issue with the texture and the lines. So for those that have a lot of lines, they may need more than somebody who doesn't have as many lines, obviously, same as dermal filler. The dermal filler tends to fill in the lines specifically, and there's still certainly a place for that, but this is more a biostimulator, so it just keeps stimulating the collagen. And that's great for the skin. Well, if you've got pretty good skin already, you don't need this particular product, obviously. So but certainly people that have those concertina lines, people that have this area that is sagging, they're the ideal sort of candidates. And even if they've just got an initial mild version of that, it then will maintain and prevent that getting worse with age. So it's what I often say to people: look at your mother, look at your father, see how their face has gone, see if your face is a similar skin type, similar shape in the face, and you'll see how you're going to go, and see if you will benefit from doing something that will kind of counteract the aging process and the gravity that pulls the face down. It depends on the skin type, but good anti-aging products, good antioxidant type creams, and collagen stimulating products that are proven, evidence-based ones. So we use quite a few of those. And this marries in really well with the biostimulator. So it augments it and makes it work even better. You really need to have some lines there, I suppose, or some sag in there. You could use it as a preventative treatment, but if someone is fairly good with I think I would be starting with home products first and using this as a treatment that will augment that when you get to a certain point where your face is starting to sort of fall down, the lower half of it, if you like. That's when this particular biostimulator will be really worthwhile. So what they need to do is they can either book online or they can book through our reception here. They just make a phone call, and usually I have to talk to them. They need to sign consent forms. We go through all the information, and I have to assess them and make sure it is appropriate for them, because I don't go ahead, and my other doctor, Dr. Jamali, who is doing it as well, we won't go ahead unless we think it's suitable and that it is going to benefit the patient. So it's very important, and we just run through everything with them and make sure they're happy, and then it's fairly quick, the treatment. It's just the 5 little injection points, tiny little needle, and it's probably takes the actual treatment itself 15 minutes at the most to actually do the treatment. But it's the talking beforehand and making sure they're well informed, and that they have read the consent form and they understand everything before we go ahead. So that's very important. It depends on the patient, because some people just want to find out about things and what the other options are for them as well. And if they know what they want and they're pretty sure that's what they want, we book them in for that. But it's possible they might come in and I say, look, it's not what I would do. I would do something else, depending on what their skin is like and what their focus is. Because it depends what they've read, or a friend might have had it, but it might have been appropriate for a friend, but not for them. So, yeah. So it just depends how they look. And we take photos, and we run through the photos together, and we sort of say, well, what's best bang for your buck, if you like? What's the best thing, or what's the thing you want to focus on? And that's all about tailoring it to a particular person's needs. So it depends if they've got sun damage as well. So if they have sun damage with pigmentation or veins, then quite often apart from using really good products at home, and there's a lot of products for that sort of thing, and apart from using sunscreen, it might be that something like the broadband light machine might be a first port of call to try and even out the pigmentation first, because that does cause a bit of collagen stimulation. and it might be the products along with that. And then if they have a fair bit of sagging, there are various different ways that you can treat that. You can treat it not only with a biostimulator, but you could also treat it with, say, something that performs skin tightening, or you might even have skin needling that causes skin tightening and renewal of the skin, or skin needling with heat, which is called Vivace, which causes tightening, or it might even be a skin needling with a particular product that we use to inject in the skin, which plumps and hydrates the skin, and the skin needling does its own job of stimulating. Or it might be that this particular biostimulator is a good thing for them, or it may be that dermal filler or a muscle relaxant type might be the best thing. It's so individual. So we also do treatments in clinic, such as hydrofacial or chemical peels, or we might do microdermabrasion and LED light. There are various different things that everybody's different, everybody's skin is different, and it depends what's suitable for them and their budget as well. So that's important.